roles. You carry many different hats. And so I presented this topic at the Rural Health Center conference earlier this year, and so I'm drawing from that presentation if any of you were there. So what we'll talk about over the next hour is the responsibility of navigators compared to other clinical staff. We'll also discuss some ways to manage when you do have multiple responsibilities. And as we did in level 1 and other courses that we offer, we'll talk about self-care. So let's start with, what are all the different roles that you have? So in some sites, there are care coordination staff and patient navigation staff, and they're kind of separate, although I would imagine there's a little bit of overlap. But there also might be staff that have clinical duties within the clinic and are also doing patient navigation. So on this slide, it shows some of the common activities of these different roles. So for example, an LPN is able to work with individual patients, taking their vitals and working on patient records. Medical assistants have a little more expanded role as well. And so what we find around the country, especially in rural areas, is that the person who's doing the patient navigation activities is also doing lots of other work. So what other responsibilities do you have in addition to patient navigation tasks? Some examples might be you do some administration, or you coordinate patients. You have clinical support roles. Maybe you do some reception work as well, or you help to put the patients in the consulting rooms. Maybe you handle referrals, like a referral coordinator, or you do quite a bit of community engagement or outreach work. So throughout the presentation, we'll be using the chat box quite a bit. So right now, what I'd like you to do is type in, what's an example of some of the other responsibilities you have in your clinic, in addition to kind of looking at barriers to care and referring out to community resources and resources within your health system. But what are some of the other responsibilities that you do currently? So go ahead and type in an example. All right, eligibility. So insurance eligibility, that's also very common. Translation, that's very common as well. So you might have a translator hat, and then you have navigation. Prior auths, interpreting. What else? Veterans community care. So Gloria, is that managing the enrollment and kind of benefits of that program for veterans? So that is kind of a unique, separate program. Dental eligibility, interpreting and assisting, working with OB patients. Yeah, so it sounds like you know what I'm talking about, where, we talk about what a navigator does, and that probably is, half of what you do or the majority of what you do, but then each site includes other activities depending on what the clinic needs. Let's see, anything else? So lots of eligibility work. All right, thank you. All right, so what we know is that when you have multiple hats, it can be very challenging. So what we're going to talk about is, some different ways to help regain control. If you ever feel like you're running around and trying to do the navigation work, and then you have the eligibility work, and there's kind of everything coming at you at the same time. So we'll look at clarity of role, communicating that role. What's in your job description? If let's say 90% of what you do is other duties as assigned, then yeah, that's a problem. Also, how do you handle that caseload, or if you're managing a panel, how do you handle that efficiently? We'll look at self-care and time management. So let's start with definition of the role. So these are the typical tasks for patient navigators, and I'm sure you've seen these quite a bit, but they all center or focus on assessing for barriers and then acting upon identified or potential barriers. And so we have the connection to resources. We also have that emotional support. You know, most of you, it looks like, are not trained mental health counselors, but by walking alongside someone in their treatment continuum, you can't help but connect emotionally, and that's, you know, social and emotional support. Also, you might do referrals or help connect people to behavioral health services and self-management support. So many of you might be involved in that. For example, the chronic disease self-management class. All right, so what I'd like to hear from you all is, what do you think are the two most important tasks that you do at your clinic related to navigating patients? Some of them might be on that list I already gave, or you have your own kind of list of what you do. But I want to know, what do you think are the two most important tasks? I'll give you some time. All right, understanding the needs and how to accomplish the needs. So assessing the patient and then acting on the assessment. Reminder phone calls, so making sure to keep up your show rates, so reminding people of their appointments. And also, Gloria, I would wonder, do you help people prepare for the appointment? So kind of reminding them of what their urgent concerns are, or the purpose of the appointment, you know, things that they need to bring, those kinds of things. Going over prep. All right, so as they're preparing for their colorectal cancer screening. Connecting to resources, establishing a relationship with the patient and the provider, and following up on referrals that were sent, and scheduling. So making sure patients understand what's going on, and scheduling. So we're hearing a lot of, there's patient education regarding the prep and the appointments, there's the reminders, there's the scheduling, education and keeping in touch with patients. Yeah. Wonderful. Now I'd like to know, what do you think the two tasks that you do are ones that your supervisor and manager think are the most important? So what do you think what their perception is? I need the Jeopardy, the Jeopardy TikTok noise. All right, so I'm not seeing anything yet. So Lisa, are you the manager? Oh, all right. So what? All right. So your manager does believe that scheduling appointments and reminder calls are the most important. Education, documentation. Lupe, you are the manager. How about the person above you? What I'm trying to ask is there congruency in what you think are the most important work that you do, tasks that you do, and your higher ups? Or are there some responsibilities or tasks where there is some incongruency? So someone said meeting the metrics and deliverables to each program. Following up with referrals, confirming patients are satisfied with the care. Great. Communication and compassion for patients. That's excellent. Yeah. So have any of you seen moments when there is incongruence, where you are doing work that you personally feel makes a big impact on your patient's care, but the director, or maybe it's your executive director or your funder, kind of see differently? All right, rarely, that's great. Sometimes. So as you can imagine, when there is incongruence, when your expectations, in a sense, and your work and the higher-ups' perception of your work are different, that's where there are challenges and can really impact the quality of your own life. So many of you have probably seen this. I hope you remember it from our level 1. But because, you know, let me explain. The title, patient navigation, is becoming widely understood across the healthcare system nationally. That doesn't mean that people actually know what you do specifically. And each clinic tailors the navigation role according to its own needs. So communicating your role is very important to both your colleagues, your funders, your higher-ups, your patients, and your community partners. So in level 1, we asked you to do an elevator speech to try to encapsulate, and it's so hard because you all do so many different, you know, different things and can do different things based on the needs of the person, but to try to hone in on how do you explain your role in an efficient and effective way, depending on who your audience is. So I'm curious if you could put in the chat how you communicate your role. Have you used an elevator speech like what we discussed in level 1 to help increase understanding of what you do, or what other ways have you tried to communicate your role efficiently and effectively? So some examples are, I know some programs actually have like a handout or a one-pager that is trying to set the expectations for what your navigator can do for you and with you, and what your expectations are for the patient. So I'll give you a minute or two just to write in the chat box, how do you communicate your role to other people? All right, Laura, you use an elevator speech with kindness and humor. I like that, Julie. Would anyone else like to add? And introduce myself, and depending on what role I am playing it to be in topic. Yes. So that's a wonderful point. Many, you know, when we do have multiple hats, then we have to explain whatever role it is at the time. So for example, those of you who interpret for patients, you're probably using your interpreter hat, and that has a very kind of unique role in and of itself. And so explaining that to the patient, and then when you do your navigation or advocacy aspects of your role, then you're explaining that part. Clarify impatience, absolutely. All right, so I have a scenario here. We'll see how we can do this discussion by chat. But Maria is a clinic staff member who was hired to navigate and interpret for her community members in order to increase access to care. However, her supervisor asked her to cover the front desk while her coworker is on maternity leave. So now she spends much of her time filing and faxing records and cleaning up exam rooms after clinical visits. She wants to explain to her boss the importance of the navigation activities, which she no longer has time to do. So I would like to know from all of you what you think is, what kind of information would be useful for Maria to approach her supervisor in order to negotiate, perhaps cutting back on the front desk time and allowing for some of the navigation interpreting time. So what information do you think her supervisor needs to hear or understand in order to allow for less coverage of her coworker? So perhaps data on identifying barriers for patients in order for the patients to have access to health care, so they're missing out on that. She needs to know that some of the patients who need interpretation are not being helped, so perhaps with her not having the time to interpret, how is that impacting the non-English speaking patients? The referrals and scheduling won't get done if you're doing this other job. And the referrals and scheduling are very time sensitive. So what's being lost? Data and numbers to give her supervisor an understanding of the impact of her absence. Absolutely. Concrete communication that her enrollments are down and patients are getting access to much needed care. Yes. So I know that documentation of everything that you all do is probably the last thing that you want to do every day, or maybe you don't get as much pleasure out of that as the interaction with patients. But it does come down to the data. What was she spending her time on, and in what ways did that impact patient care? And so we see in level 1, many patient navigators say, my supervisor has no idea what I do, or he or she is not really clear on how I'm spending my time. And so this is very common. They might have access to data and look at it once a month, or maybe when they're doing reporting. But you also can have a clear idea of what your value is and what your impact on patient care is. All right. So oftentimes in the supervisor class, we would ask, how many of you have job descriptions for your patient navigation staff? And we do hear from managers that they don't. And it could be that the role was added on to an existing position in the clinic, or someone is basically has a dual role, or they moved into the navigator role, but it was never really clarified. So what I'd like to hear from all of you is, what is in your description related to care coordination activities? Or maybe most of your job description is related to care coordination. Now, it's always ideal for you to write your own job description if you can. It looks like someone has. And so it's probably the most accurate of anyone. Because as a manager, when I write my navigator job descriptions for a program that we're developing, it's all very kind of theoretical, or we make lots of assumptions. And it's not really until your program is underway and you're in the position that you realize, that distribution of activities is quite different than expected. So we have reviewing ER reports and follow-up appointment. Excellent. All right, how about, do any of you have activities related to outreach or partnering with community agencies in your job description? Anyone? So it may not be in your job description, but do you actually go out to coalition meetings, work with, yeah, all right. So Carla does worker outreach, farm worker outreach. Great. And that's in your, yeah. So it's very common for navigators to go out and work with community agencies. So it should be in your job description. Great. How about health promotion tasks? So that might be conducting patient education. It could be delivering classes, you know, demonstration of self-care. Does your job description fully describe how you document your activities? If you chart in the medical record, if you have a program database for CCSP or the state that you also enter data? And how about communication? Does your job description include the activities or the aspects of communication that, that you do? So that could be communication with patients, communication with your team members within the clinic, communication with your agency partners, communication with funders, you know, it's lots of communication. So think about that. It's always good to go back and look at your job description and make sure that it really does align with what it is you're doing, because that can help your manager or director, or the higher ups, truly understand what you're doing, because you know, it's delineated in the job description. What about other duties as assigned? So if you have a dual role, both tasks or activities or responsibilities for each role should be in your job description. So the navigation work really should not be the other duties as assigned, because you're held accountable according to both your metrics and deliverables, but also how well you perform what's in your job description. All right, so I would imagine many of you have, you know, your panel or the long list of patients that are need to schedule colorectal cancer screening or have scheduled the colonoscopy, and you have, you know, you have to make those reminder calls. I'm curious if many of you have other groups of patients, like a panel or a registry, where you have to reach out to these patients and conduct, you know, calls and meet with them and help them with action plan. So when you have a large group of patients that you're responsible for, it can certainly be overwhelming. So within each panel, it is effective and efficient to prioritize those patient groups based on a variety of factors. It can be based on medical urgency. It could be based on clinic need or clinical needs. It could also be based on social determinants of health. So if they have higher levels of social determinants of health issues, then they're at higher risk for, you know, a variety of health concerns. You might also prioritize based on short-term needs, longer-term needs, but kind of having a way to manage a large group of people will help you to feel more in control. So I'd like to hear from all of you. How do you prioritize your patient, you know, your patient lists or your patient groups? So I'll give you a minute to type it in. organize by time-sensitive needs. You can filter. That's great if you have filtering capability. Any other suggestions by those that are experiencing symptoms? So those are more urgent. Yeah. Working from panels and patients as they come in for visits. So the todays will come first. Hello.
Hi.
Hi. Did you want to add something?
Oh, no, sorry.
All right. So Julie says the PCP explains, helps to identify those priority patients. So that's great. Really, as long as you have some way to help prioritize, and that way, you know, I'm sure you can still get overwhelmed, but it's, but there is a mechanism for making those decisions. All right. So now we're going to move into self-care. So I'm not going to ask because I think I can guess that many of you have probably had moments or times or weeks, months, hopefully not years, when there's frustration over, you know, it can be changes, it could be overwhelming amount of work. Maybe there's difficulty in finding the appropriate resources for your patients. But that is, you know, very common for a patient serving type role. There might be time management difficulties, especially when you know, you might have your prioritization and then set so you know what you're going to do, but then other needs come up. Also, there might be some issues around the adequacy of maybe staffing. So everyone is trying to cover what they can. We talked about prioritization, making sure that you do have some way to prioritize so that it's not a struggle to stay on top of the workload. There's stress and fatigue. And we know that when you feel like you're kind of doing multiple roles, sometimes people feel like they're never able to focus on one role and kind of meet the expectations of that role. Oh, so yes, Julie mentioned the biggest frustration is when you spend so much time helping a patient and they do not follow through with their part. And any of us that work on behavior change, that is always the issue. And so that is a good, you know, there are different ways to deal with that. Certainly if you, you know, remember in the motivational interviewing part of the course of level 1 and then in MI Advance, you know, recognizing that we can only do so much, you know, what's within our control and what's out of our control. And the patient ultimately has the responsibility, and finding a way to kind of accept that, even though it is very frustrating and can be disappointing. So what we're going to do is assess your burnout. So what I'd like you to do is read through each of these, and you're going to mark, so just jot down for each one, like, I feel run down and drained of physical or emotional energy. So would you say not at all, rarely, sometimes, often, very often? And you mark down which one it is. So if it's not at all, it's 1 point. If it's very often, you put 5 points. But I'd like you to go through each of these, and I'll give you 5 minutes. Go through each of these and mark down how many points you would assign to each. And then we'll see how burned out you are. This is a different assessment than what you did in level 1. So, so please go ahead and do it. So I'll give you a few minutes. and you'll add it up. All right, so I did mine. Were all of you able to count it up and come up with a number? If someone could type in yes, then I'll go on to look at the coding. All right. Okay, so let's see how you're doing. So those who scored 15 to 18, you guys are, oh my God, you're good. You're fine. No sign of burnout. And I would ask that you teach this class on burnout because I'm like super high. 19 to 32, little sign of burnout. 33 to 49, you're at risk for burnout. 50 to 59, how many of you, did any of you get that like me? Severe risk of burnout. And those over 60, that's, you know, I have some referrals for the crisis line. Okay, so I'm kind of, you know, not making fun, but, you know, I'm trying to make this humorous, but it is really, really important that we identify when we are starting to move into burnout or in burnout, because it really can impact you. It impacts you physically, emotionally, psychologically, and how can it not impact our work and our relationships? So what do you do about that? And I'm really impressed that so many people are just little sign and at risk. That's much better than, you know, severe. So it comes down to self-care. So what are some self-care practices? Well, we have to think about what makes you feel your best. For me, it's when I'm on vacation, but you know what? I have to work, so, but I don't take vacation. So maybe it's making a commitment so that you do take that time off when you need to. How do you feel your best? Many people, it's exercising, it's being around family and friends, but think about that. We have to add self-care activities to your calendar. Many of us don't leave the desk for lunch, don't take breaks. Or when we say we're going to take a day off, we don't really mean it and end up working. So what is it that you can add to your calendar to make sure that you take care of yourself and you do the things that really do make you feel your best? We have to think about our physical well-being. If any of you have had thoughts like, this job is going to kill me, then, you know, it means that we need to do more self-care practices. Physical activity is great. Sleeping, there's a lot about sleeping hygiene now that shows the importance of sleep. Nutrition foods. Now, how many of you are good at saying no? Is anyone good at saying no? And Casey, the link is on the slide, so I think Amy will probably send the slide set out to you. I'd love to hear who has kind of mastered this. Learning, it's difficult. Yeah. Yeah, I mean, we are caregivers in this role, but not being able to say no moves us into that, can move us into that high risk area because we become overwhelmed. And when you feel like you're not able to do any one thing very well, or most of what you need to do very well, it really can impact you emotionally. Do periodic reviews. So kind of assess your burnout risk occasionally so that you can get back on track. Are you working too much? Now, I would imagine that you know, there are times where maybe you're a crunch time, maybe it's reporting time, and you have to put the time in. But is that a regular part of your job? Then you'll be at risk for burnout. What can you stop doing? And what do you want to add? So in many self-care like workshops, they talk about, if you think about all the things that you do, you know, both at work and at home, are there some things that are not required or someone else can do, so that you can replace that with something that will help you feel more energized and satisfied? And also, for those of you who say that you have difficulty saying no, what I always hear from people who have very good self-care practices is that when they say yes, that means they will take something else away. So they're not constantly adding on to their plate, but the idea is that if you say yes, you're replacing something with that yes. And create a positive environment. So sure, there's a place for us to vent and, you know, talk about how difficult and challenging everything is, but there's also the need to have that positive space, that positive environment that help you feel re-energized or recommitted to the cause, to the mission, to, you know, why you do what you do, because what you do is so important. So think about the people you're around, the things that you do. And remember, I know I would say this to my cancer patients, you can't take care of others if you don't take care of yourself. So it's one of those things where we might say to other people, you know, sometimes you have to put yourself first, but we don't always do it ourselves. And that is super important. All right, so what I would like you to do is, in the chat box, make a commitment to one self-care practice, and it doesn't have to be on this list, but maybe it's something that you've kind of thought, I really should get up and walk around during breaks, or I do actually need to take a lunch break. Something that you can do to help take care of yourself and help try to lower your risk for burnout. So I'll give you a minute or two to write in the chat box. Okay, now this is called accountability. You have made a statement in front of everyone that you are going to walk, you're going to do periodic reviews, you know, you're going to find ways to kind of occupy yourself during conference calls to help you listen better. And I wonder, Julie, are you coloring during this webinar? Actually leave when you say you're going to. Thank you, Julie. Yeah, so Lupe said, actually go to a quiet room to complete a project. Yes, because when you're out and with your colleagues, you know, everything gets bombarded at you and you get distracted. Wonderful. Oh, I love this. Take time off and don't take the computer or work with me. That is an excellent, excellent idea. And then not feel guilty about it. Wonderful. So the last piece is about time management. And I thank all of you for sharing your commitment with me. And maybe in a month or the next CCSP webinar, Amy can check in and see how it's going. So the last piece is time management, and this paper is about time management skills, I think actually for physicians and providers. But what they say is that you need to have a compelling goal. So you need to say to yourself, you know, why is it that I want to manage my time better? Maybe it's so that you have more time to be with your family and friends. Or maybe it is so that you feel like you could be more efficient and effective with your patients. Whatever it is, but you need to kind of have that motivation, you know, why is it important for you to do that? And then find ways to become more organized. So many of you might, again, we had talked about that long list of patients that you have to call, which is overwhelming. So then how do you prioritize it? Same with your different tasks. How do you prioritize what you'll do on your list of to-dos? And then dealing with priority tasks. So they suggest planning for the week and using your calendar, estimating time to complete that task. Now for me, whenever especially if I have to do writing like curriculum or report or whatever, I estimate my time, but then I know that it'll probably take 3 times more than what I estimate. So I've kind of got that figured out in my head that, you know, okay, I say an hour, but probably it'll end up being the whole morning, and that way I can try to schedule around that. All of you deal with fires probably daily, so how can you organize your day so that it won't be quite as disruptive as it may be typically? So be ready to put out those fires, but not derail, you know, your daily work and your priorities. And then the last piece is something that we talk about in, you know, problem solving and coping skills, and that is if something is overwhelming, then what is achievable? What are small achievable pieces? So let's say you have to contribute to a report, but the idea of writing the whole report is too much. What's that first paragraph? You know, and then you kind of you schedule it out, or you can pull the numbers for that. So you feel like you're doing something towards the overall goal, but it's not as overwhelming. Or again, the prioritization for patients, say you have a patient with lots of needs and it's like a lot for you to do. Well, what can you do over the next half hour? You know, 3 calls instead of 10, or you can do 1 form or application and get that done, and you have a sense of accomplishment. For me, I have to mark off my to-do list, and if it's not written down, I write it down so I can make that check off. Because all of us have the kinds of jobs where it doesn't end at the end of the day. There are things that we're doing throughout the week and throughout the month. And so finding ways to feel like, all right, I completed that, can give you a sense of control in some respects and satisfaction. So with that, I am going to turn it back over to Amy. We have about 11 minutes, so I'd be happy to open it up for questions and answers.
Yeah, so at this point, you are welcome to participate, or you are welcome to go ahead and unmute yourself if you would like to ask in that way. If you are on your phone, it's star, so keep that in mind as well.
I'm glad to see someone else has to check things off their to-do list. If any of you would like to share some of your examples of time management strategies that you found to be very helpful given, you know, how paced a clinical environment is, either you can speak up or you can put it in your chat box. But I'd love to hear and learn from all of you what has worked. No one? Oh, I see some. Breaking down deadlines into smaller, more manageable pieces. Excellent, excellent idea. Oh, the self-evaluation test. Great. And the link is in the slide. Remembering when your day of organization does not work out that day, it's okay. Great. Adding deadlines to my calendar at least a week in advance. Wonderful strategies. You know, the idea is so often things feel out of control. So finding those, you know, kind of small ways to kind of get back that control over your daily work, knowing that things change and needs change. Asking for downtime. Yeah, work-life balance. I like that, WLB. So someone asked about strategies to argue the value of patient navigators as individual positions. So there is, depending on what area you work in, if it's colorectal cancer screening, there are at least a few articles, published articles, that demonstrate the cost effectiveness of colorectal screening. So it shows the amount saved and really makes the argument for colorectal screening navigation. If you could use that kind of information, then I would suggest reaching out to Amy, and Amy can let Andy and myself know, and we can find there are papers on the business case for patient navigation. If you think that there's the financial aspect, and then there's the benefit or the value to patients in terms of their, you know, health outcomes. So we do have that. You know, in colorectal cancer navigation is, you know, widely published throughout the country. Good. Well, I'm glad someone is feeling at least a little more positive about their role. As I said before, you all have such an important role to play in our healthcare system. And we're so fortunate to have CCSP and Amy and Elsa and Andy really advocating with your leadership for patient navigation, for reimbursement, you know, for recognition. So, so let us know if you have other ideas or you have other needs for the, you know, the justification and the evidence. You're welcome. All right, Amy, do you have any things that you need to say about the next webinar or CCSP?
So if you notice in the chat, I did just put the evaluation link. So if you guys wouldn't mind taking just a quick minute to go ahead and complete that, we really appreciate your feedback. And you know, anything extra that, you know, you feel like you want Dr. Valverde to cover, you know, next time she joins us, anything more that you want some depth or clarity on, definitely, that just really helps us to provide the best tailored experience for you. And then honestly, just if you pity us, we have to do it for the health department. So whatever your motivation is, if you don't mind just filling out the eval, we appreciate it. And anything else, feel free to reach out to me. I'm going to send you the slides and all of that good stuff as soon as we are done here today. So if there's no other questions, I will go ahead and just say thank you to all, and a gigantic thank you, Dr. Valverde. We really appreciate your expertise and your support. And just so all of you know, in the background, Patty is with us all the time and really helps us as a program. She is a wonderful person, and you don't get to see her and hear from her much, but know that she really is always here for us and supporting the work that you guys are doing. She's a huge, huge support to navigation. So just a huge thank you to her for all.
Can I just say one thing? So I don't actually know who R. Hornback is, but again, please reach out to us, you know, to Amy, and we can supply you with materials around the evidence and the business case for navigation. So please.
I know who that is, so I will send something to you, Ruby. All right. Well, thank you all so much, and we will be connecting with everyone soon. Have a wonderful rest of your day, everyone.
Thank you.
Thanks. Bye-bye, everyone.